All right, good morning, everybody.
Good morning.
How's everyone doing today? Okay, awesome. Hey, Andrew, welcome. Yeah, thank you so much for taking time out of your days to join us today. I'm just curious, where are you guys from? How many of you are from Mississauga? Mississauga? Okay, and then what about the rest of you?
Brampton.
Brampton?
Pickering.
Pickering? Toronto?
Etobicoke.
Etobicoke? Toronto? Okay, awesome. Well, we have an amazing presentation in store for you. I'd like to start just by kind of sharing a little bit about my story, how I got involved with functional medicine, and then I'm going to be introducing Dr. Brar, and he'll be your presenter for today. So, just like you, my story is actually with digestion, so this workshop is actually special for me. I was diagnosed with IBS. How many people have been diagnosed with a similar type of condition? Yeah, so I went through the traditional system. I saw my family practitioner. I saw a gastroenterologist and endocrinologist. Then I went to see alternative healthcare providers, and nothing really worked. All the food that I was eating was making me feel sick. So at my worst, I was going to the bathroom like 7 to 10 times a day, stressed out. I was anxious about even going out. And then yesterday, I was actually out with Andrew. We were out dancing until 1 a.m. and we went out to eat. So it was a huge transition being able to go out and not have that social anxiety and be able to go out and dance, be able to go out and eat. So it's been a journey over the last few years, but it's been well worth the investment. And what happened is there's root causes. So the reason I had digestive symptoms is a couple of reasons. It was multifactorial, but what happened is all the testing that traditional medicine does, they don't really get to the root cause. So everything came back normal. My blood work was fine. My scopes were fine. They couldn't find out what was going on with me. But when I found functional medicine and the Living Proof Institute, I was able to run the right kind of testing, and I found out I had a parasitic infection, a bacterial infection, high cortisol levels, poor energy production in my mitochondria. So all these different things were contributing to it, in addition to a stressful job. And yeah, that when you look at it that way, you're always stressed out and sympathetic. You're not able to digest your food because you're not getting blood flow to your digestive system. So going through this process was absolutely transformational for me. So I'll be around at the back. If you guys want to come up and chat, I'm happy to connect with you. And then I'm going to introduce Dr. Brar, who's an amazing clinician. So I've been seeing him for the last few years, and I would say he's the best positioned practitioner, if not one of the best, if not the best positioned practitioners in all of Canada when it comes to functional medicine. So I was actually on the phone with a few of you, and I was saying that people flying from Dubai, people flying from Alberta, people flying from the US to see us, and then people that are local to here. A lot of the times we had about double or triple the amount of people in this room register for the workshop, but things come up, people can't make it, so that's why we're recording it, so we can share this information with people all over the world, because people need to hear this. So if you guys can think of one person that could benefit from this, we'd appreciate it if you could share this message as well. And then yeah, Dr. Brar, he's somebody who's very compassionate. He has his own story, so he's dealt with digestive issues for over 10 years. He's also tried everything under the sun, every diet, every possible solution, whether it's traditional or alternative, and the information that we're going to present today is going to be transformational if you come with an open heart and an open mind. And I've been to over 100 of these workshops, and I learn something new every time, and I think Andrew can agree as well. He's been to quite a few and always picks something up. So yeah, Ricky is also, one thing I wanted to share with you guys is functional. How many of you know what functional medicine is? Okay, so just a few of you. So the simplest way I would explain functional medicine is root cause testing. So we get to the root of the problem. So if you imagine a river and we're downstream, your symptoms are downstream, we go all the way up the river, up the mountain, and we see what is actually causing these symptoms downstream instead of just trying to manage it with symptoms and medications. We want to see what's the reason you're experiencing these in the first place. So that's the simplest way to use functional medicine. And the way I like to explain it also is a combination of the best ancient techniques that we know, things like breathing and things like meditation. Welcome, coming in. Combined with the latest testing, now we can test biochemically what's happening to your cell health, what's happening to your brain health, what's happening to your organ health, what's happening globally to your health. We're able to measure this now and combine the two and tap into your body's innate healing capabilities. So we're at a very interesting point in history of humanity where we're able to now combine these ancient principles with modern science. And there's a lot of scientific literature coming out now speaking about the benefits of meditation, for example. And then, Ricky's going to share the 6 overlooked causes today, and he'll be sharing his personal journey as well. And we run how many healthcare providers are in the house right now? Okay, awesome. So we actually run a training program for healthcare providers as well. It's called the Living Proof Mentorship Program, where we train practitioners, whether they're medical doctors, naturopathic, or chiropractic doctors, how to practice functional medicine, because people really need the service. And the problem is most people don't know it exists, or they don't know what it is. So Dr. Brar is going to present some awesome information today, and he's worked with hundreds of patients. I would say he's the expert in digestive health. So let's give Dr. Brar a warm welcome.
Thank you, and just 1 second here while we switch over the mic.
Let me clip it in. Put it under?
Just clip it over, I guess.
You just want to clip it over?
Yeah.
Put this in your pocket.
Sure.
Or the back. This is good.
Thank you, everybody, for coming here, and thank you for taking the time out of your busy weekend to come learn about digestion. I want to make sure nobody's trying to sneak in, so everybody's in the right place for sure. Awesome. So I know a lot of you are here today because you might be suffering from a digestive challenge. A family member might, a friend might, maybe just for general education. I know quite a few hands went up when Tibby asked if there's any healthcare providers in here. What we're going to go over today is the 6 most overlooked causes of digestive issues. Now, that doesn't mean it's the only causes. There's numerous causes to digestive issues, but I'll go through the main 6. My goal here today is not to necessarily teach you something new. I'm sure a lot of you know some of the information I'm going to tell you today. The internet is a vast and scary place, and I know many of you might visit Dr. Google frequently, especially with something like digestive issues. I know I did, I know Tibby did as well. So what I'm trying to do here today is to put the puzzle pieces together and help you connect the dots better. I don't want you to have to spend hours and hours researching when I've already done that for you, and many people like me have done that for you. So my goal today is to allow you to know that you don't have to suffer. There is another answer, and put it together strategically. And I know when Tibby asked how many of you have been diagnosed with irritable bowel syndrome, a few hands went up. Now, IBS, if you really think about it, it's irritable bowel syndrome. What the heck is a syndrome? It's just a collection of symptoms. So many people suffer lifelong and they're told they have IBS, but it could be for 10 different reasons. So if this entire room had IBS and I looked at all of your testing, literally could be for 10, 12, 14, 15 different reasons. So every patient comes to us in a very unique place. We call it an N=1 experiment. So every patient's unique and our approach to every patient is unique. We look at the same foundational mechanisms, so a lot of what you're going to see today are common symptoms that a lot of you might suffer from, but there's multiple reasons for having those symptoms. So I'll start by just sharing a little bit about me. I'm currently the clinical director at the Living Proof Institute. Oh, sorry. So I'm the clinical director at the Living Proof Institute, and what we are is a functional medicine clinic. Now, again, just by a raise of hands, how many people have heard of functional medicine before? It's quite a few, and I love to see that, because when we used to do these workshops years ago, nobody heard about it. It was something completely new. And for those of you that don't know what it is, as Tibby gave the analogy of going upstream to find out what's coming downstream, functional medicine is basically where scientific evidence meets common sense. And the reason I say that is a lot of the testing that you have done, common lab work, many people in this room, including myself, might have had to endure a colonoscopy and endoscopy. Some of you at a really young age as well. These tests are looking for something big. They're looking for a growth. They're looking for high levels of inflammation. They're not assessing function. Rarely does any conventional test assess function. So we use scientifically validated tests to assess function. But on the other side, if I tell you that, hey, you probably need to watch your stress levels, you probably need to meditate more, you probably need to eat better, you probably need to have more vegetables in your diet, all of these things, they're more common sense. I shouldn't have to show somebody piles and piles of research to do that, because there isn't piles of research. There's really no money to be made in that research. So functional medicine tries to find the root cause or root causes to why you have a certain condition. And today our focus is going to be on digestive issues. I also serve my community as a functional medicine practitioner, so this is what I do full time. A clinical mentor, so as Tibby mentioned, we have doctors all across North America. We coach on our methods and how to practice functional medicine. So we've trained doctors all across North America, actually parts of Europe as well. And it's medical doctors, it's naturopaths, it's chiropractors, it's nutritionists, it's all of the above. And the reason for that is functional medicine is this even playing ground. So you don't have to have a functional medicine degree to practice functional medicine. And many people can use the same principle. So after you leave here today, like what I see this entire room as is the doctor of the future. You guys are going to be taking care of yourselves. And the reason you're here on a Saturday when you could be in bed or warmer than it is outside today, it's because you guys are passionate about learning more. And for some of you, it might be for pain reasons. Your pain might be big enough that you want it to come out today. So we're going to go over a tried and tested method as well. I'm also a public speaker, so I've spoke all across Canada, on the West Coast as well. And I share my story and my journey, and I also teach doctors on different ways to assess patients. So both to patients and doctors, and I'm an author as well. I've had the pleasure of learning from some of the best doctors across North America, and now devote my career to share the most effective system I've found to health with patients across the world. And I know sometimes I gave a workshop at the Brampton Rotary Club, and one gentleman came up to me and he's like, I didn't know they give medical degrees to 15-year-olds. So I know one of the things there is I've had an accelerated journey. I've literally learned from some of the best people on the face of the planet, people who have been practicing for 30 years. Even in our clinic, we probably have well over, I'm guessing, 50 years, even more than that, of experience clinically. So when you learn from somebody who's been through it, you learn the common mistakes. So today I want to act as your mentor, and I want to teach you guys the mistakes I made, the mistakes I've seen patients make, and why people suffer for so long needlessly. This is our clinic here. We're located just down the street near the Square One Shopping Center. And this is our Mississauga office. We also have an office in the US in Ohio. But again, we practice functional medicine, so we're right in the heart of the city. And I was very happy to see people have kind of come from all over. A lot of you are from Mississauga and might not have heard of us before. Some people are Toronto, Brampton, shout out there, I'm from there as well. But that's our clinic there. So I always like to start off by just, why are you here today? And even before I start asking you why you're here today, it looks like a great room. I see a lot of bright faces. I just want you guys to take a second, and some of you might feel uncomfortable doing this, but just look around at people around you and turn your head all the way around. Look at the faces of people. And I can see like a lot of you are breaking out into smiles and things like that. So we don't often connect on that level, but the purpose of this exercise is just look, like I'm scanning the room as we speak. I don't see a single one of you that looks sick. There's no one in this room I could be like, hey, you're sick. Some things you wear. So if you have lots of acne, you wear it. If you have psoriasis, you wear it. If you have inflamed joints, I can see you hobble in here. I can see you limping. But digestive issues, fatigue, thyroid issues, all of these issues that are commonly just kind of scraped under the rug, we don't wear them, right? I had a patient not too long ago, and she's since graduated our program and she's doing well, but she has rheumatoid arthritis and it really affects her hands. And looking at her, she always has a smile on her face, bright, radiant glow, awesome, not overweight, nothing really going on. And she was entering our building where our clinic is, and she pressed the easy access door button just to have the door open for her, and somebody walked by and they're like, save it for people who need it. So she broke down in my office. So a lot of us, we don't wear this. Like nobody would know. Tibby looks like a healthy young man, and he looked very similar a few years ago. It doesn't necessarily mean that you're gonna change. So this is a mystery condition, and we need to bring more light to it. We need to bring this to the forefront, because the ways to assess for why you feel the way you do are available to you. So I just want to start by, you could raise your hand, shout out the answer, but what are some of your goals by being here today? Any volunteers?
I'm just here for my son who has IBS and eczema, so
Okay.
I
Like histamine intolerance? Okay, mast cell activation problem. Okay. Anybody else? Yep.
I'm just here because my digestive system is like a lot of problems for a long time.
Okay.
I need to find out what root cause it is. Because I've gone to the doctor, I've gone to do all the tests, and
Thank you for sharing. No, for sure. And the other thing with digestive problems is it's a spectrum, right? Some of you might go to the bathroom 5 times a day. Some of you might not even go 5 times a week. So both are problems, right? Both will make you feel uncomfortable. And the thing with a diagnosis is it's a label. So even IBS syndrome, hey, you have X amount of symptoms in this category, so let's put this symptom label on you. When I found out I had IBS, I was like, okay, so what do I do now? Like, you almost feel grateful, you feel like things have resolved, you feel closure because you're like, I know what's wrong. But then when you find out what you can do about it, it's nothing, right? How many of you, just by a show of hands, have been told you just need to eat better and exercise more? Majority of the room, right? So it's these things that are just commonly kind of slipped under the rug. They're just not shed light on, and I know it's big. Yes?
My doctor diagnosed me with this bacteria that's called H. pylori.
Okay, that's big. So H. pylori is an infection, and we will talk about it as well. Any changes after you found out?
They gave me a bunch of different medications, and I still need to go back and test again.
Okay, we'll talk about that. It's a big one. Yes?
I was diagnosed with IBS at a young age, and I also had an episode of diverticulitis.
Okay. And there we bring the inflammatory side into it as well. I almost need a dictionary to spell diverticulitis. Anyone else? Yep.
Chronic urticaria with mast cell destruction.
Okay.
We passed the H. pylori, passed all those tests, the scopes, we can't find anything, all that.
Okay. And the thing with H. pylori, and I won't kind of go too much into detail about it right now, but we'll talk about it later, but it's kind of the first player, and then a cascade of effects come afterwards. You don't have to only get rid of it, but you have to get rid of the cascade of effects it led to. So you could see that most of you are here for more digestive-based issues. Some of you are here for infections. Some of you have something called mast cell activation and histamine problems. What that means is that your mast cells, which produce histamine is almost a defense mechanism. If your gut is injured in anywhere, you release histamine. If you eat really inflammatory foods, you release histamine. But individuals who end up with things like urticaria and mast cell activation, they'll break out into hives. Even scents and things like that will make them break out into hives and itchiness and rashes and things like that. So no, and again, just by, I only wrote 5 things here. I'm sure there's long stories and long journeys in this room, but you can see that there's many different symptoms at the top of that pyramid. But what could be going on underneath that pyramid might be similar in a lot of you. So this workshop is for people who want to feel carefully listened to and deeply cared about, successfully recover from their health challenges, create practical and sustainable habits. So I know many of you might be on restrictive diets right now, and for some of you it might actually be giving you some sort of relief in the moment, but you have to think diversity, you have to think long term. The more restricted your diet is now, the more your large intestine will suffer long term, because it depends on diversity from foods and things like that. So it might be the starting point to alleviate symptoms, but it's not a good long-term practical strategy. We travel, we end up going on the road. There isn't always organic everything available to us. So we need to make sure that the solutions are practical and sustainable. Uncover the root causes, and I hate to see it when you go to a doctor's office, and I'm not anti-medicine by any means, but I hate to see it that you're only allowed to bring up 1 to 2 complaints per office visit. You could have multiple things going on, right? So how could you be limited to there? Like, I could have a rash right now, and I could have a stomach ache, and they both might be coming from the same infection. But I'm only allowed to tell them about 2 things, so those are the 2 things, and I'm probably given something like Pepto-Bismol, I'm probably given a topical agent. Nobody looks at those root cause mechanisms, so you're entitled to more than 1 root cause. And then spend less hours researching online, and that's the big one. Like, it's almost ironic a little bit, right? Like, you guys found me probably searching online. I probably popped up on Facebook, or you found us through Google or something like that. So we want you to spend less hours researching online, because if you study the healthiest people on the planet, Do they spend lots of time worrying about every little food that they eat? Do they spend time Googling different symptoms and why they might have it? No, they don't carry around charts with them with their blood work mapped out. They don't carry around food diaries and things like that. So we want to make sure you spend less hours researching online. By the end, you'll discover the 6 overlooked causes of digestive disorders, the exact method we use to help even the most challenging cases. And my case was challenging. I know Tibby's case was challenging, and some of you might be coming to me today here, and I might be the 10th plus person that you've either heard lecture about something or that you've personally gone to visit. So we share why that might not have worked for you in the past. I don't consider us the end all and be all by any means, but when you put strategy into it and you have the right lens, a lot of good things happen. Why the conventional approach isn't enough, and I always like to make the analogy that conventional blood work, I love it. I love seeing it. I recommend you get it annually, but it's kind of like looking at you from 30,000 feet up from an airplane. It kind of tells me when there's a fire going on. It won't tell me what started that fire. Was it just a bunch of kids playing with matches? Was it a natural disaster? You don't know. You have to zoom in much deeper level than that. So that's why you could have the cleanest blood work. I had the cleanest blood work. Tibby had the cleanest blood work. So these things don't share the root cause mechanisms for you. And then a proven strategy for long-term health. And then we'll just start with a couple housekeeping items. So you should have all got a survey. Just by raise of hands, does somebody not get a survey? Tibby can come hand out. So up front and at the back there. Yeah, so absolutely no rush to finish them. We'll just have you hand them in at the end. So just fill it out and write legibly, especially the email if you did want to get a recording of this workshop. And then also before you leave, I'll offer you a special gift for attending today. And as Tibby mentioned, we had probably about 3 times as many people, if not more, signed up for this workshop. So not everybody can make it, and that's one of the reasons we are recording it as well, because we know with digestive issues, many might have planned to make it this morning. Something might have come up symptomatically. Others, I know the weather makes a big difference in some individual symptoms, and it is a pretty gloomy day outside today. So make sure that you do write legibly. So this is another exercise I like to start my presentation with, and a lot of the individuals, especially some that raise their hand to comment with these issues, they really can't start with the end in mind, because a good day for them is a day without symptoms, and those don't come too often. So when you start with the end in mind, take this room that we're in, take this community center that we're in. Do you think they just came in here and they're like, okay, let's just eyeball it and let's make this room? No, they drew architecture, they drew maps, and they planned it out well in advance. So they reverse engineered what they saw from an image. They're like, okay, this room has to be 20 feet long. Many people can't do that. They don't see far enough to do that. They don't start with the end in mind. And if I asked the individuals that told me that they're suffering from these symptoms here, what would be your goal? Like, why do you want to get rid of it? What would it do for you? And most of them wouldn't be able to answer it. Like, I've asked that question so many times. If you woke up tomorrow and you had perfect digestion and no issues whatsoever, what would you do? Most people can't answer it, because literally they can only see far enough. And it's kind of like driving with no headlights on and it's pitch dark outside. You can only see a couple feet in front of the road. If you have your lights on, you can only see what the light gets, but you can't see further than that. So I like to start with your desired state, and for many of you, you might want to feel more energetic. You might want to feel more motivated, more clear, more happy, more calm, confident, balanced. But your current state might be tired, unmotivated, foggy, depressed, stressed out, low self-esteem, feel like you're on a roller coaster. And the missing link seems to be the connection between the two. So how will you get there? So I know many of you came from outside. How many of you, just by a raise of hands, use their GPS to find this place today? And when you did type in where you wanted to go, did you say, hey, around this area, or did you type in the exact address? Yeah, so you knew where you wanted to go, you typed in the exact address. So people don't have a roadmap, they don't have a strategy, and that's the big missing link. As I mentioned, I'm not really here to teach you something new, I'm here to show you how to put the pieces together. And that's the key missing link. Now I know this is something that many of you can relate to. I know for 10 plus years, every time I walked in a building, the first thing I looked was, where's the bathroom? And it's something you make a note of, and it's almost embarrassing when you tell other people that, right? You almost want to do it inconspicuously, like, hey, Check mark, it's right there in case I have to run. But it's almost become a joke. We can laugh about it today. Some of you might not want to laugh about it at all. But this is a big reality for us. We normalize everything. So if somebody's going to the bathroom 8 times a day and they're not really getting better, guess what they're going to do? They're going to keep living. They're going to keep going to the bathroom 8 times a day, and they're going to keep suffering, but they're just told they have to live with it. So one of our goals is to hopefully untrain that response, because you won't need that response as much. This is one of my favorite charts here, and it kind of explains the conventional approach to healthcare, and this is why it doesn't work. I know most of the people in the room, like H. pylori, technically speaking, you're not born with it. IBS, technically speaking, you're not born with it. Urticaria, you're not born with. Diverticulitis, you're absolutely not born with. So these things you're not born with. So we all started off healthy at one point. Now, where you guys probably started feeling your symptoms most was in between here. We call it the pre-symptomatic phase. And that's when your body starts to give you some whispers. And one of my favorite quotes is, listen to your body's whispers before you have to listen to its screams. And some of those whispers might have been early stomach aches. It might be eating a certain food that you've been eating for years and just not feeling good after it. And where it's typically diagnosed is when you have full-blown symptoms. So you might go to the hospital because you saw blood in your stool. You might have been really feverish. You might have had not gone to the bathroom in a week. There's many kind of different scenarios that play out, but this is one where it's usually picked up. But there's a long trigger phase here, and it's not always autoimmune, but that trigger could have been stress. It could have been an H. pylori infection. It could have been a virus. It could have been a breakup. It could have been multiple things. And this is why, to get over something like digestive issues, you have to take a comprehensive approach, and people don't do that. So where most people come into us is usually in the degenerative phase. And that's because we normalize everything. If you start noticing that, hey, I used to have 1 bowel movement a day and now I have 3, guess what? It's just, hey, maybe I'm getting older. And that's one of my most hated excuses as well, is, hey, this is just a symptom of getting older. There are no symptoms of getting older necessarily. Your digestion should work similarly. Your brain should work similarly. You shouldn't notice degeneration in these areas. So what we try to do is reverse engineer this and find out what those triggers were for you, and then also find out what they might have cumulatively done to you over a certain period of time. So the big thing here is death by diagnosis. If you're told you have IBS, it kind of puts you in a box, right? And you don't want to go outside the box for a solution, because you might not know if it works for you or anything like that. That's what labels do to us. And a label can be wrong, a diagnosis can be wrong up to 38% of the time. So what does that mean? Most importantly, 38% of the time the treatment method is wrong. That's scary stuff. 1 in 3 people, so even in this room, 10 of you would have had the wrong treatment applied to you. So digestion is interdependent. It's not independent. It's not this kind of singular process. Just doing a colonoscopy and getting that negative doesn't mean your digestive tract is very, very good or healthy or anything like that. There could be other functional markers that can tell you that, hey, you have an imbalance or something like that. And everything happens for a reason. If you went out right now and grabbed some fast food from a drive-thru, guess what? Your digestion has to work overtime. Whereas if you had something very light, like a soup or a puree, your digestive system doesn't have to work as much. So the inputs you give your digestive system produces the outputs. And that might be the symptoms that many of you are going through today. So the 6 overlooked causes, and I'm going to go through each of these in more detail. The number 1 cause of digestive disorders that we see, and it's usually the starting point, and as I was saying, H. pylori is just the starting point, is digestive sequencing. So your body goes through a systematic process, and everything is there for a reason. So even your appendix is there for a reason. So all of these organs play a vital role in your digestive process. Number 2 is intention. Why are you eating the foods you're eating, and what's your mind state like while you're eating them? Number 3 is low stomach acid, and this is something I see, it's almost an epidemic, because what's the number 1 thing that bottoms out stomach acid? It's high stress lifestyle, and we'll talk about that as well. Low stomach acid will lead to food sensitivities. How many of you in here have done a food sensitivity test? So a few hands went up. And did you guys just find that most of your staple foods were on that food sensitivity test? Yeah? So if you really think about it, how could something that keeps you alive be causing you harm? Food keeps us alive. How can you react to a food? And we'll talk about that mechanism as well. The 5th one is leaky gut. How many of you have heard of leaky gut? Wow, so majority of the room, that's awesome. And same thing here, like we used to do this workshop 2-3 years ago, and we would get a hand, maybe two, and it was usually from a healthcare practitioner. So many people are educating themselves on this. And then the big one, this is one of the main purposes of this workshop. It's to tell you something you don't know as well. And that's stealth infections. So we'll talk about those in good detail. And this is one of the biggest stealth infections that can happen is H. pylori. So we'll start with digestive sequencing, and I like to start with an exercise. So I know some of you are writing, but if you just want to even put one hand up or both hands up, put your hands on your cheeks. Now, kind of bring them toward your mouth slowly. What do your cheeks do? They turn into the inside of your mouth, right? And we don't really think about it like that. So once it turns into the inside of your mouth, it goes mouth, esophagus, stomach, small intestine, large intestine, and out. And guess what? We have butt cheeks, so it's skin again, right? So we don't really think about our digestive tract like this. Our digestive tract technically is a tube that runs inside of us, but it's actually outside of us. I know it's crazy to think if you guys even rolled up your survey right now, and you could see if one end is your mouth, the other end is your back end, and it's one tube. So when you have things like skin conditions, hives, eczema, a lot of times they're manifestations of what's going on the inside. So everything is there for a purpose. And with digestive sequencing, it's this neat little tube system. So digestion starts in your mouth. You want to chew your food very well. If you don't chew your food, I know I'm not going to make anybody raise their hands here, but some of you might see undigested food in your stool. The only reason to see undigested food in your stool, especially vegetables, is because you didn't chew them. Nowhere else in your GI tract is there teeth. So when you're eating something like a salad, they've actually done a study and they found that approximately, somebody want to guess how many times you think you have to chew your food before swallowing for optimal digestive health? And
30 times.
Pretty close.
40.
Closer. Perfect, yeah, approximately 44 times. That's how many times you have to chew your food. Now, I don't do that. I'll fully admit that. It's kind of not that practical, right? But it's a big component to digestion. So the more you chew your food up here, the less everything else has to work, especially if you're eating vegetables and things like that. Now, the other thing that can happen in the mouth is you can see I'm missing teeth as well, is if you have any sort of infections in the mouth. And I had 2 infected root canals that I got removed, and I chipped in a car accident when I was 8 years old, and I carried them around for 22 years before I got them removed. So with those, they were causing me inflammation all the time, and I was swallowing that infection. So poor dental health can cause digestive issues as well. And then we hit the stomach. Chewing signals stomach acid. So you can see it's kind of starting to come together. Stomach acid is so vital because it helps you digest protein. If anybody has difficult time putting on weight, or they have a hard time putting on muscle to be specific, it's usually due to low stomach acid production. And then stomach acid combined with the chewing signals your pancreas in the back here to make enzymes to help you break down carbs primarily. And then the gallbladder, this little pouch here, that stores bile, and that releases bile to help you break down fat. So everything is there for a reason. These organs aren't all over the place. They're connected in a neat line. And then it goes into your small intestine where the main purpose is absorption. This is where you get your nutrients from.